Hey everyone, happy Monday. Welcome to Facebook and Instagram Live with Genova. We're doing these daily videos hopefully to give you some useful clinical pearls and pieces of information to bring into your practice. My name is Christine Stubbe. I'm one of the medical education specialists here at Genova in Asheville, North Carolina. And I love talking about the GI tract. And so one of the things I'm going to talk about today is the inflammation and immunology biomarkers that are on our stool test. So I have a sample report here of our Fx stool test. And on page 4 of the report, we have in the center of the page some inflammation markers here. So we have 3 of them. We have calprotectin, eosinophil protein X, and secretory Iga. And so we also have another test called the CDSA 2.0 that has 2 of those biomarkers on it, the calprotectin and the eosinophil protein X. So calprotectin is an inflammatory marker that's made by the neutrophils, and neutrophils are white blood cells. This inflammatory marker is associated with inflammatory conditions like IBD, inflammatory bowel disease, which consists of Crohn's disease and ulcerative colitis and other inflammatory diseases. Calprotectin can also be elevated if a patient has a serious GI infection. It can be elevated if somebody takes NSAIDs, nonsteroidal anti-inflammatories, such as ibuprofen. So it's a really serious marker when it's elevated. And when it's elevated outside of the reference range, usually that warrants a referral for colonoscopy to go work with a specialist. The calprotectin also happens to be a marker that Genova actually brought to market here in the US. We helped it go through the FDA clearance process. So we're proud of that. It's a very important marker. It's been FDA cleared to distinguish inflammatory bowel disease from irritable bowel syndrome, which is a less serious disease, although the symptoms can be problematic for both. The other biomarker that we look at, eosinophil protein X, is an eosinophil-mediated inflammatory marker. And when we think about eosinophils, that's another white blood cell, we think about allergies, like an IgE-mediated food allergy. We also think about parasites. Not every parasite triggers eosinophil protein X, but worms can trigger EPX levels. The third inflammatory marker that we look at is secretory Iga. And secretory Iga is the chief antibody that's secreted across mucosal membranes. And so it's going to be secreted in higher amounts in response to something. And so what might the immune system be responding to in the gut? Well, it can respond to organisms like a pathogen or potential pathogen. It can respond to a food, as in a food sensitivity. So these biomarkers can kind of help you identify whether a patient has inflammation in their gut, and then you might have to go on to do some further testing to see what's actually causing that inflammation. A lot of clinicians will use therapies that are anti-inflammatory, like fish oil, or anti-inflammatory diets. Turmeric or curcumin is very anti-inflammatory and has benefits with lowering some of these markers as well. So those markers, like I said, are on our GIFX stool test. There are also a couple of them are on our CDSA 2.0 panel stool test. And those are orderable. They can be drop shipped directly to the patient's house, so they don't have to come into the clinic to pick up those kits. So they can stay safe and collect those samples from home right now during this stay-at-home initiative that we have. So if you have any more questions about our testing, or you want to become and you want to sign up and have an account with us, our phone number is 800-522-4762. You can email us at info@gdx.net. You can always visit our website, www.gdx.net. And I hope you guys have a wonderful day. I look forward to talking about more GI health next week. Take care.